My name is Benveniste. I completed my orthopedic training in Adelaide, then sought to undertake a clinical fellowship and chose St Michael's Hospital in Toronto as it came very highly recommended to me from several colleagues who had performed fellowships here over the last 5 to 10 years. For me, the fellowship was an opportunity to further enhance my surgical skills, particularly in hip and knee arthroplasty as well as some trauma.
The fellowship program's been running for 35 years. We've had fellows from literally every corner of the globe here, and we have a very well-established program. We have a large arthroplasty practice with a number of surgeons doing different techniques, and it allows a great breadth of experience.
I came on my fellowship with my family in 2012, and I loved it so much I was delighted when they invited me to come back as an attending surgeon. The OR is a very friendly place to be, and when you spend 5 days a week here, you kind of become part of the family.
So the typical working week at St Michael's, I spend 4 or 5 days in the OR. Lists are generally from 7:30 a.m. till 5:30 p.m. We focus largely on primary arthroplasty, but also a large number of complex cases and revisions. And generally we would achieve 5 cases per list. There's an excellent turnaround time in the operating theatres here. There's also scheduled educational opportunities each week with resident teaching on Monday mornings for trauma and Thursday mornings for arthroplasty. In addition, there are fellows rounds every fortnight where the fellows and staff surgeons discuss upcoming complex cases and revisions.
Fellows should apply approximately 2 years prior to their anticipated arrival. This gives them a chance to plan for the future and gives us a chance to make sure that we have an appropriate number of fellows for that time slot. Right now they should apply to my email address, which is waddellj@smh.ca. We need a formal application. We like the fellows to write to us directly with appropriate references. Most of this comes by word of mouth, former fellows promoting the program.
Get your medical school certificates notarized. Get letters of confirmation that you did attend medical school and you did pass your board exams or your Royal College exams. You may also need to go and see a physician who's accredited by the Canadian visa people to get a health check. Once all that's in place, you'll then have to come to your visiting hospitals on the day your fellowship starts and get accredited by the CPSO. Additionally, you'll have to get full coverage in terms of indemnity, and that's from the CMPA.
So Toronto's a wonderful city to live in. I arrived in winter, which was certainly a change in climate for myself from Australia, but the city's really very well equipped for winter lifestyle, and I managed to get away for a few weekends for some skiing at some of the local resorts. Now we're into the warmer months. It offers a fantastic lifestyle for families and for getting out and about socially and otherwise. It also offers an excellent place to base yourself for travel around Canada and the northeast United States.
What do most fellows do in the summertime for their vacation?
They work. They work while I go on holiday.
When it comes to a couple of months before you arrive, you'll need to start thinking about where you're going to live. And that really depends on who you come with. If you're young and you're single, then I'd really recommend downtown. If you're coming with a family like I did, I think it's probably better if you live a little bit away, maybe no more than 2 or 3 miles. The U of T has a separate department dedicated to the dozens of fellows that come from across the world to do fellowships here. They are there to make your life easier.
The Arthroplasty Fellowship at St Michael's is an excellent opportunity to participate in a high-volume arthroplasty centre, and it offers fellows an opportunity to directly participate in a large number of cases and certainly enhance your experience in simple primary as well as complex primary and revision cases.